So imagine you are like a total skeptic of alternative medicine. You are someone who completely relies on Western science.
Right. You want the hard data.
Exactly. You want empirical data, uh, lab results, the standard peer-reviewed medical procedures.
Yeah.
But then a single profoundly personal experience completely flips your entire worldview.
Wow.
I mean, it flips it so drastically, in fact, that you end up dedicating the rest of your professional life to mastering the very thing you used to completely dismiss out of hand.
It's a remarkable paradigm shift, really, and it actually serves as the literal foundation of the clinical practice we're doing a deep dive on today.
Yeah, so welcome to today's deep dive. We are looking into a really fascinating stack of sources today. You've got clinical service descriptions, medical methodology overviews, and some incredibly revealing patient case studies.
Which are super interesting to read through.
They really are. And it's all centered around the Berkley Center for Reproductive Wellness. It's a premier fertility clinic located right in Midtown East in New York City.
Right in the heart of Manhattan.
Yep. And our mission today is to explore how this clinic is radically blending thousands of years of traditional Eastern medicine with the absolute cutting edge of Western reproductive technology.
Which usually people think of those as totally separate things.
Right. So we're looking at what happens when you fuse those two incredibly different worlds together and what that actually means for you if you, or maybe someone you love, is navigating the really complex biological hurdles of infertility.
Yeah, and the tension between those Eastern and Western approaches is the exact genesis of the center. I mean, this wasn't a clinic born out of a slick business plan or like a market analysis.
No, definitely not.
It was born out of a deeply personal medical crisis.
Yeah, so let's get into the story of the clinic's founder. He and his wife were trying to start a family, and they were just facing these repeated, devastating failures.
Yeah, month after month.
Right. And when they went the traditional Western medical route to figure out what was going wrong, the clinical picture was, it was incredibly grim. For him, the diagnosis was poor morphology and poor motility. And for her, the labs showed anti-sperm antibodies.
Which is just an extraordinarily formidable combination of biological roadblocks. For anyone familiar with this stuff, the implications of that diagnosis are pretty clear.
It's basically a worst-case scenario.
Exactly. I mean, poor morphology means the structural integrity of the sperm is compromised, which severely limits its ability to penetrate an oogocyte. And poor motility means the localized transport mechanism is just failing.
Right. They aren't swimming properly.
Exactly. And then you add to that an autoimmune response where her body is actively misidentifying and attacking sperm as like foreign pathogens.
Wow.
You basically have a biological environment that is actively hostile to conception. So from a purely mechanistic standpoint, the probability of unassisted conception in that scenario approaches zero.
It's practically impossible. And he, by his own admission, had absolutely zero belief in acupuncture or Eastern herbal medicine at the time.
Total skeptic.
A staunch skeptic.
Yeah.
But his wife decided to consult an acupuncturist and herbalist, and she basically dragged him along.
As wives sometimes have to do.
Right. So he participated super reluctantly, and then 3 months later, she conceived.
Which is just a staggering clinical turnaround. I mean, they now have a 29-year-old son from that specific pregnancy.
Okay, let's unpack this, because it's one thing to have a successful, miraculous feeling treatment and, be incredibly grateful.
Sure.
But it's another thing entirely to completely change your life's trajectory. He didn't just leave a glowing 5-star review on Yelp. He spent the next 4 years in acupuncture school and then another 2 years strictly studying herbal medicine to become the very first acupuncturist in the U.S. to specialize entirely in fertility.
It's an intense pivot.
It's like a diehard flip phone user suddenly becoming the lead developer for Apple. But I have to push back here a little. Just because someone has a successful personal experience with a treatment, does that automatically make them a qualified medical practitioner? I mean, surviving a plane crash doesn't make you an aeronautical engineer.
It certainly does not. And if he had simply, hung a shingle on his door the day after his wife got pregnant, that would be straight up medical malpractice.
Exactly.
But the personal experience was merely the catalyst. What transforms a patient into a pioneer is the rigorous clinical pursuit that follows. He underwent 6 years of formal medical training to understand the exact mechanisms of what happened to his own family.
Sure, the academic training is there now. But your sources note that his personal journey inherently built this bridge of empathy, right? That he knows the exact crushing despair his patients feel when another month goes by with a negative test.
Empathy is crucial, yes.
Empathy is great for bedside manner, sure. but empathy doesn't alter an immune system that is actively attacking sperm. So what actually bridges the gap between his personal trauma and real clinical efficacy?
Well, what's fascinating here is that the bridge isn't just emotional, it is intensely biological. Beyond the empathy, there's a crucial detail in his origin story that basically dictated his entire medical philosophy.
Since that.
He noted that it took exactly 3 months of treatment before his wife conceived. That 90-day timeline is not a coincidence.
Oh, really?
No, it perfectly mirrors the biological time frame of folliculogenesis and spermatogenesis, which is basically the time it takes for immature oocytes and sperm to fully develop and mature.
Wow. Okay.
So he observed that biological reality firsthand, and that 90-day window became the absolute central pillar of his clinic's entire methodology.
Okay, so we have this 90-day biological window. But how do you actually influence a microscopic cell deep inside the reproductive system during those 3 months? That brings us to the actual clinical toolkit they use.
Right, the specific interventions.
Because the sources detail a mix of therapies that sound ancient and incredibly futuristic all at once. Needles, herbs, and lasers.
Quite the combo.
Let's break down the mechanisms of these therapies, starting with acupuncture. They use this to improve blood flow to the ovaries and the uterus and to regulate hormones.
Yeah, and rather than just looking at acupuncture as placing needles in localized points, we really have to look at the hemodynamics.
Okay, break that down for me.
So, acupuncture stimulates the peripheral nervous system, which sends signals to the brain to downregulate the sympathetic nervous system, that's your fight or flight response,
Right.
and it upregulates the parasympathetic nervous system. When that happens, you get systemic vasodilation, blood vessels dilate, specifically reducing impedance in the uterine arteries.
So it's physically opening up the pathways.
Exactly. By actively increasing that localized blood flow, you are delivering much higher concentrations of oxygen, nutrients, and endogenous hormones directly to the ovaries and the endometrial lining.
Which creates a much more hospitable, nutrient-rich environment for the egg.
Precisely.
Then there's the herbal medicine component. And they aren't just telling patients to, take generic over-the-counter prenatal vitamins from the pharmacy.
No, not at all.
They create completely custom formulas for each patient. The clinical goal stated in the sources is to reduce oxidative stress, boost mitochondrial efficiency, and improve the uterine lining. The clinic uses a really specific phrase to describe this synergy. They say, herbs work from the inside out, while acupuncture works from the outside in.
And that is a vital functional distinction. The herbal formulations act as powerful antioxidants and adaptogens right at the cellular level.
Okay.
You see, reactive oxygen species, or oxidative stress, essentially act like rust within the body.
Rust.
Yeah, it actively degrades the DNA integrity of both gametes, so the eggs and the sperm. By introducing specific, highly concentrated herbal compounds, they are neutralizing those free radicals.
So they're cleaning up the rust.
Exactly, they're repairing cellular degradation before it compromises the genetic material.
Okay, here's where it gets really interesting. The third main therapy they offer is low-level light therapy, or LLLT. They use this for something called follicular energy enhancement to get better quality eggs. Now, hold on a second.
I know where you're going with this.
When we think of serious fertility interventions, we think of synthesized hormone injections. We think of complex surgical retrievals. Light therapy sounds like, I don't know, a cosmetic treatment you'd get at a high-end dermatologist to fix a few wrinkles.
Right, it sounds totally bizarre.
How on earth does shining a light on a human abdomen affect a microscopic egg maturing deep inside an ovary?
It does sound super counterintuitive if you are only familiar with standard pharmaceutical interventions. But the mechanism here is photobiomodulation.
Photobiomodulation. Say that 10 times fast.
Right. So low-level light therapy utilizes specific wavelengths of red and near-infrared light. And these particular wavelengths have the unique physical property of being able to penetrate dermal and subcutaneous tissue to reach the reproductive organs.
Wait, so the light is actually physically reaching the cellular structure of the ovary?
Yeah.
Inside the body?
Precisely. And when those photons reach the cells, they are absorbed by an enzyme within the mitochondria called cytochrome C oxidase.
Okay.
This absorption kicks off a cascade of cellular events that rapidly upregulates the production of ATP, or adenosine triphosphate, which is essentially the energy currency of the cell.
Battery power.
Exactly. As women age, the mitochondria in their oocytes naturally degrade and produce less ATP, which leads to poor chromosomal division and lower egg quality. By utilizing photobiomodulation, they are actively stimulating the cellular machinery to produce the energy required for healthy cellular division.
So they are fundamentally trying to reverse the energetic deficit in the cell. This completely highlights how the clinic views the body. They don't see it as a collection of defective mechanical parts that just need to be bypassed with a syringe.
No, not at all.
They view the entire reproductive system as this energetic, deeply interconnected environment that requires really precise metabolic calibration.
And that philosophy stands in stark contrast to standard Western care, which, frankly, often relies on what the clinic terms blunt interventions.
Blunt interventions, like what?
Like chemically hyperstimulating the ovaries, extracting the eggs, and forcing fertilization in a petri dish without ever attempting to improve the underlying health of the biological environment that created those eggs in the first place.
Right, just bypassing the problem entirely. Now, hearing all of this emphasis on energy flow, holistic environments, and traditional herbs, you might assume this is some rigid alternative clinic that completely rejects modern Western medicine.
Right, the sort of anti-science stereotype.
Exactly. But the reality is the exact opposite. The Berkley Center is highly integrated with Western-assisted reproductive technologies.
They are completely embedded in the allopathic medical world. The evidence for this is super robust in the testimonials provided by high-profile medical doctors, specifically reproductive endocrinologists.
And those are the heavy hitters.
Yes, these are the highly specialized physicians who manage complex hormonal functioning and orchestrate Western fertility treatments.
Yeah, the sources highlight reviews from really prominent MDs like Dr. Joe Massey, Dr. Paul Magarelli, and Dr. David Hoffman. These are definitive authorities in Western fertility.
Huge names in the field.
And they specifically praise his deep understanding of reproductive endocrinology. They note that he deliberately tailors his Eastern treatments in concert with the reproductive endocrinologist's treatment.
Right.
He's not positioning himself as a replacement for these doctors. He is an active collaborator. They have a specific, highly regimented protocol just for patients undergoing IVF, or in vitro fertilization, and IUI, which is intrauterine insemination.
If we connect this to the bigger picture, what we are witnessing is the critical evolution from alternative medicine to integrative medicine.
That's a great distinction.
Because alternative inherently implies an either-or choice. You either choose science or you choose nature. Integrative means you leverage the absolute best of both paradigms.
They work together.
Exactly. In this collaborative model, Western medicine is utilized for what it excels at: the incredibly precise, high-tech mechanical processes of stimulating follicles, extracting an oocyte, and achieving fertilization.
And implanting the embryo.
Right. But Eastern medicine is utilized to handle what it excels at: optimizing the physiological soil, mitigating inflammation, and regulating hemodynamics so that when the Western doctor plants the seed, it actually takes root and thrives.
The level of logistical dedication to that integration is honestly staggering. When you look at the patient case studies from women like Priya M. and Maka Oganesian, they point out a really striking operational detail. He is available 7 days a week at virtually any time.
Wow.
Yeah. If your reproductive endocrinologist schedules your embryo transfer for a Sunday morning at 8 a.m., he is there doing your specialized pre- and post-transfer acupuncture on a Sunday morning.
That's intense dedication.
It's like he's not just a consultant giving lifestyle advice from afar. He's acting like the specialized pit crew in the middle of a high-stakes Formula One race. When the car pulls into the box, he is right there, executing his highly specific part of the job to get you back out on the track in optimal condition.
That pit crew analogy perfectly encapsulates the dynamic because timing in an IVF cycle is absolutely unforgiving.
Every hour counts.
It really does. An embryo transfer is a meticulously orchestrated, highly invasive event. On the day of transfer, the sheer stress and the physical manipulation of the cervix can actually cause microscopic uterine contractions, which can expel the embryo before it has a chance to implant.
Oh, wow. I didn't realize that.
Yeah. The pre- and post-transfer acupuncture protocols are specifically designed to relax the myometrium, the smooth muscle of the uterus, to prevent those exact contractions. Having an integrative practitioner who aligns their schedule entirely around your hyper-specific Western medical window demonstrates a level of clinical commitment that is just exceedingly rare in any branch of modern medicine.
Because they are operating like a pit crew, optimizing the entire biological vehicle, the race actually starts way before the starting line. I'm looking at their treatment timeline, and it's not just, come in on the day you're doing IVF. This is a comprehensive, holistic continuum of care that addresses the entire reproductive life cycle.
It addresses the root cause rather than just the acute event.
Let's walk through the architecture of that timeline. It starts before a patient even officially tries to conceive, with a preconception phase they call the Firestarter Libido Enhancement Program.
Catchy name.
Right. This involves targeted acupuncture and daily herbal adaptogens to reignite systemic vitality and increase sexual desire. From there, patients move into the core preparation phase.
This is the critical 3-month prep. Patients typically receive treatments twice a week for 13 weeks. And again, this brings us right back to the biological foundation of his practice. Because folliculogenesis and spermatogenesis take approximately 90 days, the egg a woman ovulates today began its final maturation journey 3 months ago.
3 whole months ago.
Yeah. If you only start trying to improve egg quality a week before an IVF retrieval, you are biologically too late.
You missed the window.
Exactly. They utilize that entire 90-day runway to ensure that by the time conception is attempted, the gametes have developed in the most highly oxygenated, nutrient-dense, low-stress environment possible.
And crucially, the clinical care doesn't suddenly terminate when the patient gets a positive pregnancy test.
Right.
The treatment protocol shifts immediately to miscarriage prevention, continuing until the 13th week of pregnancy. The biological logic for that specific cutoff is that 90% of miscarriages occur by or before week 12.
Which is a very scary statistic for expecting parents.
It really is. And then there's the postpartum phase. They offer a 10-visit program utilizing custom herbs designed to combat severe fatigue, the baby blues, and the massive endocrine crash that happens after childbirth.
This specific timeline fundamentally redefines the metric of success in fertility treatment. In standard allopathic care, a positive blood test is often treated as the ultimate finish line. The reproductive endocrinologist successfully achieved the pregnancy, and the patient is promptly discharged to a standard obstetrician.
Job done. See you later.
Right. But the Berkley Center defines success much more broadly. The goal is not merely achieving pregnancy. It is maintaining the viability of that pregnancy, safely delivering a healthy child, and ensuring the mother's endocrine system successfully recovers from the profound physiological trauma of childbirth.
There is a patient review from a woman named Jane A. that I think perfectly illustrates the clinical integrity of this specific timeline. Jane actually got pregnant naturally while prepping for her planned IUI treatments.
Oh, nice.
Yeah, so she continued seeing him through her 12-week mark for miscarriage prevention. Everything progressed perfectly, and she felt so supported that she actually asked to keep paying him for treatments after week 12. She wanted to continue the regimen.
The clinical response to that request is very revealing regarding the ethics of the practice.
He explicitly told her no. He literally declined her money. He explained that it wasn't necessary because biologically, the placenta takes over the primary production of progesterone around week 12 to support the pregnancy. The research just didn't support that continued intensive acupuncture visits made a definitive clinical impact on miscarriage rates after that placental shift.
Wow.
I mean, think about how extraordinarily rare it is for a private healthcare clinic to actively turn away a willing paying patient simply because the biological science dictates that the treatment has achieved its maximum efficacy.
It demonstrates a strict prioritization of evidence-based biological need over simple revenue generation. He is treating the physiological reality of the patient, not operating like a wellness subscription service.
But speaking of revenue and paying patients, we definitely have to address the financial reality here. We've established the intense marathon-like nature of this care. You are going in twice a week for months.
It's a huge time commitment.
The immediate question for you listening to this is, how much does a highly customized, integrative experience like this actually cost? And what does this imply about the accessibility of this tier of medicine?
It is undeniably a significant investment.
Let's look at the exact pricing structures.
Yeah.
An initial diagnostic consultation is $250, though. They waive that fee if you purchase a comprehensive treatment package.
Okay.
Individual acupuncture sessions run $150 each. If a patient opts for the comprehensive egg quality improvement package, which includes 26 acupuncture visits and 26 low-level light therapy visits over a 13-week period, that totals $4,500.
Okay, so that's the big 3-month runway.
Exactly. They also offer telemedicine consultations for $350 for national or international patients who can't physically access the Manhattan clinic. And then they offer home visits. For $300 a visit, they will travel anywhere within the 5 boroughs of New York City to treat you, though the site lists a very specific, somewhat funny caveat. Outside of Manhattan, you provide the Uber.
The Uber caveat is great. It really highlights the highly localized, boots-on-the-ground reality of this practice model.
It's very New York.
It is. But we must contextualize that $4,500 package price within the broader landscape of modern fertility treatments. A single round of standard IVF in the United States can easily exceed $20,000.
Easily.
And many patients undergo multiple failed rounds precisely because their egg quality or uterine environment was not optimal prior to the procedure.
That adds up so fast.
Right. So if a $4,500 13-week holistic preparation phase improves the biological environment enough to make a single round of IVF successful, or eliminates the need for IVF entirely, as we saw in several case studies, that upfront investment completely changes the socioeconomic calculus of fertility care.
And when you analyze the patient voices in these case studies, it's not just the biological results they focus on. They constantly highlight the profound personalization of the care. They mention his relentless optimism. They explicitly talk about how he texts you back immediately, whether it's on a weekend or late at night.
Which is huge for patient anxiety.
Massive. They describe him functioning as a therapist, a medical advocate, and a coach, all rolled into one. I mean, ask yourself, when was the last time your highly specialized physician texted you back within minutes to ease a sudden wave of anxiety, or literally hopped in an Uber to administer treatment in your living room because you were on bed rest?
This raises an important question. What is the true, measurable clinical value of bedside manner? In modern medicine, we frequently dismiss a good bedside manner as like a nice customer service perk, secondary to the actual science.
Right, a bonus.
But in a field as emotionally devastating as infertility, the psychological safety of having a practitioner who is relentlessly accessible cannot be overstated. Chronic psychological stress elevates cortisol levels, which actively disrupts the hypothalamic pituitary adrenal axis, or HPA axis.
Okay, and what does that mean for fertility?
That disruption basically suppresses the release of gonadotropin-releasing hormone, fundamentally impairing reproductive function.
So stress literally stops you from getting pregnant.
Yes. Having a trusted medical guide who actively lowers your systemic anxiety, who immediately answers your texts, who holds your hand through the profound uncertainty of treatment. That therapeutic alliance is actively down-regulating the stress response. That psychological safety is literally functioning as a physiological intervention.
So we've covered a tremendous amount of ground today. We traced a journey from a staunch skeptic's desperate attempt to start a family to the creation of a pioneering clinical practice right in the heart of Manhattan.
It's an amazing mark.
A clinic that seamlessly engineers a protocol utilizing ancient herbal adaptogens, acupuncture-induced vasodilation, cutting-edge photobiomodulation laser therapy, and high-tech Western IVF integration.
It serves as a highly functional blueprint. It proves that looking backward at ancient medical traditions and looking forward at the absolute bleeding edge of modern technology do not have to be mutually exclusive pursuits.
So what does this all mean? The Berkley Center represents a profound shift in how we approach deeply complex systemic health issues. It proves that treating the human body doesn't have to be a zero-sum battle between East and West. It can be a highly calibrated alliance. You can absolutely utilize the sophisticated microscopic precision of Western lab procedures alongside the holistic environmental optimization of the East.
It is a medical model that demands we treat the entire interconnected ecosystem of the body, rather than just isolating and bypassing the mechanical symptoms.
Exactly. And that leaves us with a final concept for you to mull over as we wrap up. We started by asking you to imagine being a total skeptic whose worldview is shattered by a single undeniable biological result. We saw how a tailored, holistic 90-day runway can fundamentally alter the physiological environment enough to cultivate life where it was previously deemed medically impossible. If taking the dedicated time to prepare the biological soil can have that profound of an impact on fertility, what other chronic conditions in our lives, whether physical, mental, or autoimmune, are we completely failing to resolve simply because we are rushing to force a cure without ever spending the time to prepare the environment first?